Hey, what's up, guys? It's Confessions of a Doctorholic with Hafsa Slayman. And today I thought, let's go for something empowering, something that so many women go through. So I've got Joanna on air and we're going to talk about this. Stay tuned.
We want to make a positive difference for women all around the world. So, why do we need to have the OBGYN on speed dial?
Well, because one of the most common complications that women have are UTIs. So UTI, as most of you know already, is a urinary tract infection, and they're quite common in young women.
I agree. I've had so many friends who've had it, and they don't shy away from saying it either. It's like something that us girls tend to talk about.
Well, because when you have it, it's the only thing on your mind. It's not a pleasant experience, and you make sure everybody around you knows that.
Sounds like a pregnancy. A planned pregnancy. I guess. I mean, maybe unplanned. I'm just going to stop talking right now. Anyway, okay, so what can we do about urinary tract infections and how can we avoid it?
Well, before we can avoid it, it's important to know what to look out for if you think that you have a urinary tract infection, right? So one of the things that you want to look for is, are you having trouble going to the bathroom and actually urinating? Do you have any type of burning sensation? Is it uncomfortable to pee? This is very important because if this goes on for more than one day, chances are you want to get that checked.
Yep, sounds good. And do you think it's easy for women to go and get it checked, or is there any stigma associated with it?
So I think this is a really good point that we need to bring up. You should not feel uncomfortable and you should not feel embarrassed to talk about any problems that you have which are health related. And if you have a burning sensation when you pee, you definitely need to go to see someone because you don't want anything to get worse later on.
Yeah, I completely agree. You don't want to get more complications, and also you don't want to live with that uncomfortable feeling. Just go, get it checked, no one's going to judge you, so just go in there and get that appointment. Okay, so now that we've discussed what women should do once they have it, how can we avoid it in the first place?
So that's a really good question. If you are someone who is prone to UTIs, you've had them in the past and it's become a problem for you, one of the main things that you need to do is to make sure that you drink plenty of water and that you don't hold your urine in. If you feel like you gotta go, you go.
And also, when you drink water, that helps flush your body out of toxins. And if you pee frequently, that's gonna help flush all those bacteria out. So that's exactly why you need to do it. Another thing that we can do, which sounds kind of silly but kind of common sense at the same time, is to keep your undergarments dry.
Absolutely. Not only do you need to keep things dry, you need to keep things as clean as possible. Hygiene is the most important thing when it comes to UTIs because the reason they actually present is bacteria. So you want to make sure that you are clean and dry most of the time.
And apparently if you tend to wear pads, so like if it's that time of the month and you wear pads, change it after at least every 4 to 6 hours. Once again, hygiene, 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 hygiene. And this thing I thought was completely wild, right? Avoid scented things. So scented perfumes or like fragrances down there, and also soap. Did you know that?
So this is one of my favorite topics because every time I go to the supermarket with friends and we pass by the female section, we see all of these products that are for your downstairs area. None of those products are good for you. Not a single one. You don't want to buy anything that's going to alter the pH. You don't want to buy anything that's scented. You don't want to change the consistency of the smells or the liquids that are coming out of you. The best thing that you can do is to find a mild soap like Johnson's & Johnson's. If it's good enough for a baby, it's good enough for you, and to use that.
And that brings about a really good point. So, sometimes women freak out, and I've gotten a fair few Instagram messages telling me, by the way, I've got some interesting secretions. Should I be worried? No, you don't need to be worried because it's normal for women to have different liquids coming out. But, as Joanna mentioned, pH. pH is basically how acidic or alkaline is your vagina. And it's supposed to be slightly acidic because there is this bacteria called lactobacilli. And these guys are actually good guys down there. It is kind of acidic down there, but it keeps everything healthy and it prevents bad bacteria from invading those areas. So that's why you don't want to use things that really disrupt that environment for them. You don't want to use really intense soaps. You don't want to use intense fragrances.
And another thing, your urine is slightly acidic as well. So if you try to alter the pH, that is actually going to make things worse because you're allowing bacteria to start going up your urinary tract that were not supposed to be there to begin with.
Yeah, that's exactly right. That sounds kind of scary. I'm just like imagining like someone kind of climbing the ladder inside your body.
That is exactly what the bacteria are doing. It takes a very long time, but when they get to their destination, you are going to have a lot of trouble.
Sounds like a perfect holiday. They're probably honeymooning in there or something. Excuse my poor jokes. Anyway, another interesting thing was tight clothing. I don't know, do you have some more to share?
Tight clothing is a bit of a doozy. Tight clothing on its own isn't really going to cause you a problem. It's tight clothing for a prolonged period of time and sitting down. Your body needs to breathe as well. So if you have an environment where there's no air flowing, again, some bacteria like to grow in that environment, and that's what you want to avoid.
That's kind of sad for me. I love my tight leggings,
As long as you're walking around, you can keep wearing your tight leggings.
And squatting.
That shouldn't be a problem.
Listen, leggings are the way to go. They're comfy. You can do splits in them on the go. No complaints there.
Because that's what I'm looking for in a hospital setting, to be able to do splits.
Listen, some patients need entertainment, okay? If I'm a patient, I need entertainment.
I like to keep my patients as low maintenance as possible. No splits for me.
Okay, that's a quote right there. Fair enough. And here's another thing that I think all of us need to talk about. When you wipe, and it's something that not many people enjoy talking about because everyone starts screaming TMI. When I start speaking about my bowel movements, all of my friends go like TMI, but I think it's quite interesting. So when you wipe, front to back, because you've got different bacteria like around your back door. You do not want that to come forward. When those come forward, they do nasty things.
Absolutely. Always front to back. And honestly, if you can hop in the shower a little more frequently, do it, Just wash your parts.
There we go. Another quote from Joanna. Wash your parts. So, another thing we need to think about is safe sexual practices. So, surprisingly, or not so surprisingly, sometimes when people have sex, you can transmit certain microorganisms. So, always safe, safe, safe. Also, apparently, it's really good to wash up before and after having sex.
Alright, so let's talk about this for a second, because there's a lot to unpack on this subject. First things first, even if you're both super, super clean, sometimes friction alone can cause UTIs. So if you are susceptible to UTIs, and women know if they are or not, if you've had multiple UTIs, you know that you're susceptible. Friction alone can sometimes promote growth of bacteria and UTIs. So I just want to make sure that we don't have any misinformation. Even if both partners are clean, sometimes a woman can develop a UTI from friction alone. Now, we've already talked about hygiene. If you do not keep your areas clean, that is also going to promote bacterial growth and is a risk factor for a UTI. The last thing to say is that sex can get messy, okay? So,
all kinds, or there's specific types in mind.
For those who want to know more, there are different channels. I'm not going to get into this. If you're curious, you'll find ways of getting the information that you need. But for the most part, sex can get a bit messy. So the important thing is, post-coital, you want to wash yourself. And a lot of people get the urge to urinate after sex. Don't stay in bed. Go to the bathroom and relieve yourself, because what you're doing is you are cleaning your urinary tract by doing this. And it's actually going to mean that you're going to have less chance of having a UTI. It's basically flushing, you know? You're allowing the urine to flow, and this is going to clean things up, and you're going to be better off afterwards.
Yeah, you're kind of literally detoxifying yourself if you pee afterwards.
Absolutely.
And this is the final thing, and I thought the most surprising thing as well. Apparently, do not shave downstairs. I don't know if I agree with that.
Don't shave.
Yeah.
What? No, I don't know. This literature, I don't know who wrote it. You know, hair is not going to make its way up. You know, as long as you keep things clean, you can keep things natural as well. And you do you, boo. Like, you want to shave. You want to get laser treatment, get laser treatment. Just make sure that you're clean. That's it.
There we go. Just make sure you're clean.